I want to promote healthier food options in my office. So my colleagues and I have been talking about this. We've met about this at staff meeting, and we all agree that we want to do a better job of practicing what we preach and making some healthier items available in our workplace. But there's this pesky vending machine down the hall that's always just full of soda and candy. So one way to promote healthier options would be every time the vending machine is restocked, I could walk down the hall, I could remove all of the sugary beverages and chips and replace all of those items with water and healthier snacks. Now, this is a totally hypothetical example. You can ignore the fact that this is not something that I would actually do. It's not something that I'd recommend that you all do, but the point is that at a basic level, this is an example of an environmental change, right? So I'm physically changing the environment of my workplace. Where there was once soda and chips, there's now water and trail mix. Another way to promote healthier choices would be to talk with the distributor who stocks the vending machine. So I could ask the distributor to start stocking healthier items so that I don't have to keep doing it myself. This would be an example of a system change. So we'd be intervening at the level of the distribution and delivery system. And then lastly, I could turn to policy by putting this change in writing. So I could work to update the actual contract that my company has with the distributor to require them to only stock certain healthier items. So this practice would then be built into a written document that the distributor would be bound to implementing. So that's kind of a simplified way of thinking about what each of the PSE components looks like in action. And if you refer to the slide deck that will be going out to folks after this webinar, or the playbook itself, you'll see that we also include some more straightforward dictionary definitions. And I won't read through the entire definitions here, but the gist is that policy change refers to the creation or the alteration of a formal written statement. The system change refers to informal and ongoing changes to organizational practices or procedures. And an environmental change directly alters the physical, economic, social, or messaging environment. And my experience in PSE trainings or conversations with folks is that at this point in the discussion, there's usually one or two people listening who get sort of hung up on categorizing the work that they're doing into a specific box. So, you know, people get really hung up on saying, okay, is this a policy change or a system change or an environmental change? The reality is that so just think back to that, how I could put a policy and if you to get involved in PSE efforts, and there's definitely no one-size-fits-all approach. So if you're the kind of person who's saying, you know, am I doing this right? Am I missing a step here? Just know that there's no one right path. So I'll be sharing some examples today. There are, of course, a bunch more examples and case studies laid out in the playbook. And these are all meant to give you an idea of what could be done and how others have approached this work. But just keep in mind that, you know, your path, your community context your community partners may look different. So let's talk for a minute about roles. The playbook outlines a range of roles that healthcare providers might play, from sort of the lowest level to the highest level of involvement. At the low end of intensity and involvement, you might find that you play the role of a connector. So that involves identifying other providers in the community to augment support for an issue. You could be an advocate, which means that you are personally coming out in support of a specific policy or decision or change. For a medium level of involvement, you might be an amplifier by, say, writing an op-ed or agreeing to be interviewed about an issue. You could play the role of a team expert by joining an existing collaboration or partnership and providing some subject matter expertise. And then finally, at that highest level of involvement, you may want to step into a leadership role. So you'd really be the person steering a PSE effort and holding others accountable. And it's important to mention that this isn't a static list, right? Your role might change over time. You might start out as a connector, but end up getting really invested and really involved in an effort and eventually come to lead it. You might find that you need to step up or step back for various reasons. But no matter the role or the roles that you play, just know that your involvement really does matter, right? Healthcare providers are uniquely suited to support PSE change efforts because when it comes to health, you're perceived to be, and you are, experts in your field. So your involvement really can lend some credibility to this work. So with that, I want to dive into some actual examples. And I'll say that for a bit of a framework, the PSE Playbook is divided into 5 main topic areas. So it covers interventions related to healthy food and beverage standards, food security, school wellness, safe routes to school, and structured physical activity. And as I mentioned at the top of this webinar, in the interest of time, I'm really going to zoom in on just 2 of these areas today. And I'll start with school wellness. And what I'm going to try to do is get 2 birds with 1 stone here. So I'm going to talk about school wellness in general, sort of talk about the issue area and what's possible. And I'm also going to use this opportunity just to orient you all to how information in the playbook is laid out. So each topic in the playbook starts with what's the impact section. It looks like this, where we describe the scope of the problem. So in the case of school wellness, research shows that the school environment affects students' health. The types of foods and beverages available in schools, how those foods are marketed, access to physical education, and even how outdoor areas of the school are designed, all of those factors have been shown to have an effect on students' diets, their exercise levels, academic performance, even their behavior. And what we also see is that there's a disproportionate effect. So low-income youth, youth of color, and rural youth tend to rely more on schools as a source of food and physical activity. Yet it's these same youth who are more likely to attend schools with limited healthy food options, limited physical education programs, and outdated recreational equipment. And in turn, these disparities that I just mentioned in access and in quality of school environments correlate with poor health outcomes among those same students, right? So low-income students, students of color, rural students are disproportionately affected by outcomes like obesity, diabetes, heart disease, dental decay. So for all of these and more reasons, the school setting is one particularly powerful place to intervene. So right under that section where we talk about the impact, we highlight some ways in which PSE interventions could improve school wellness. So here, possible interventions include applying healthy food and beverage standards to snacks available at after-school events, requiring or encouraging improvements to physical education programs and recreational facilities, and establishing recess and lunch policies that really maximize physical activity among students. So after setting the context and laying out some potential intervention points, the playbook then highlights 2 case studies for each topic area, one of which focuses on a rural area, just to give you an idea of what this actually looks like in practice, right? So how do these ideas take shape in the real world? And I'm going to go through one of them right now just to kind of give you that picture. So one of the case studies that we highlight in the school wellness section involves a champion provider fellow who got involved in updating Sacramento's local school wellness policy. And I'll take a step back just to answer the question of what a local school wellness policy is. So a school wellness policy is a written document that provides guiding information for a local educational agency or a school district to create supportive school nutrition and physical activity environments. And I wanted to talk about this topic specifically because getting involved in updating and strengthening a local wellness policy is one really great way for healthcare providers to tap into local policy efforts, because many schools are actually required by federal law to have a wellness policy in place. And not only that, the law also says that the district must allow stakeholders, so that could be you, to participate in the development, implementation, and review of this policy. So all of this to say that this is a particularly timely, relevant, and appropriate way to get involved in local PSE change in your community. And there very well may be an existing work group or coalition focused on school wellness that you can join. So, so back to the case study. Okay, so in 2015, the Sacramento City Unified School District began its process of updating its wellness policy. And Dr. Zoe Gore, who's the champion provider fellow that I mentioned, and that's featured in the playbook, got involved in this process. So Dr. Gore joined an existing committee. It was called the Coordinated School Health Committee. She showed up, she participated in committee meetings. Those meetings included folks like school district staff, parents, teachers, food service staff, representatives from various community-based organizations. It was a pretty diverse group of stakeholders at the table. And Dr. Gore, who is a pediatrician, had been very active in the community already around food security and obesity prevention issues. So kind of drawing on that experience, her unique perspective as a physician, she was able to provide input on nutrition and Dr. Gore was really operating in that role of team expert. She joined an existing committee and participated in their meetings, and she offered her expertise to help shape the nutrition and physical activity standards that would go into that wellness policy. So the Sacramento Unified School District was able to take all of that input, both from Dr. Gore as well as all the other stakeholders at the table, and they drafted a new policy. And here are just some of the things that were laid out in that policy. So it prohibited the school from offering food as an incentive or a reward for behavior and performance. It requires all food offered during the school day to meet the Smart Stacks for Schools guidelines. So those are nutrition guidelines developed by the USDA. It encourages staff to choose water. So it really kind of puts in writing that it encourages adults in the school to model healthy choices for students. and it ensures that physical activity and recess are not taken away as a form of punishment. So these are just some of the provisions that ended up in that policy. I'll also mention that this is where they landed in Sacramento. That keep in mind that if you work on school wellness in your community, there are definitely opportunities to tailor the policy to your community's unique circumstances. It might not look exactly like this. And if working on school wellness is something that you're doing or that you're interested in learning more about, here is where I'd recommend you start. So first, look it up. Does the school district in your community have a wellness policy in place? And if so, what does it say? Many school districts put their policies online, so a good just first place to start is just Googling your local school district plus the words wellness policy, or pulling up the district's website and searching there. If you're not having any luck finding anything online, you can also contact the district office directly and ask them. Second, get in touch. See if there is an opportunity to get involved or join a local committee, just as Dr. Gore did. So the latest rule that came down from the federal government actually requires the policy itself to identify and name the person who's essentially in charge. So if you're able to find a copy of your district's wellness policy online, the person who you should talk to, or the person who at least would be the best first point of contact, is actually baked right into that policy language, which is pretty helpful. And again, if it's not there, or if you can't find contact information, you can always contact the district office directly. And then lastly, learn more. There are a bunch of great resources on this topic that get into way more detail about wellness policies than I've got time to cover in just a few short minutes. We at ChangeLab Solutions do a lot of work in this area, so you can hop over to our website at the URL on your screen. If you click the link toward the bottom that says ChangeLab Solutions Resources, it pulls up a bunch of stuff, including general overviews and fact sheets, as well as some actual model policies that include specific policy language and ideas. The CDC has a great resource that profiles a whole bunch of diverse school districts and their approaches to school wellness, so that's definitely worth checking out. And then the Alliance for a Healthier Generation has also been a real leader in this space, so they've done a ton of great work to make sure to make sense of the guidelines and the requirements for local wellness policies that came out of that federal rule. And they've got all sorts of tools to help folks assess the strength of current policies, opportunities to improve or to strengthen them, etc. So you'll have access to all these slides. The bottom line is there's a lot of great resources to pull from. If this is an area that you're working in, you definitely don't have to start from scratch. So we are going to shift gears now and dive into the second topic area that I wanted to cover today, which is food security. Just to set the stage for a little bit of context, food insecurity is defined as the lack of consistent, dependable access to an adequate supply of food for a healthy life. There are just a bunch of different ways you can approach food insecurity. One of the many strategies, though, to increase the affordability and the supply of healthy foods and beverages is to make sure that low-income individuals who are eligible for federal food assistance programs are actually enrolled in those programs. So that includes things like the Supplemental Nutrition Assistance Program, also known as SNAP or food stamps, the Special Supplemental Nutrition Program for women, infants, and children, among some others. So this brings me to the second case study that I wanted to highlight today, which is the San Diego Food Prescription Program. This is a pilot program started just this year in San Diego County and was really spearheaded by Dr. Patricia Cantrell. Dr. Cantrell is a pediatrician. She is also a Champion Provider Fellow, and she's a former president of the San Diego chapter of the American Academy of Pediatrics. So I was hoping to have Dr. Cantrell join this webinar live to share some of her experiences, but as I'm sure many of you can relate to, she's a working physician, she's got patients to see, and we weren't certain that she'd be available during this time slot. So instead, I'm doing what I think, or what I hope, is the next best thing, which is I'm actually going to be kind of talking through and setting up the work that she did, and then I am actually going to play some pre-recorded audio clips of Dr. Cantrell talking about her work, so you can kind of hear her experience and her perspective directly from her. So these audio clips are pulled from 2 different conversations. So one was from a conversation that one of my colleagues had over the summer. It's actually the initial interview that we conducted with her in order to write up the case study and the playbook. And the second is from a follow-up conversation that I had with Dr. Cantrell just last week, and that she very graciously and kindly allowed me to record for this. So here is where this example begins. A couple of years ago, the American Academy of Pediatrics, or the AAP, released a policy statement about food insecurity in the United States. So it stated that 16 million children live in households without consistent access to adequate food. And it recommended that pediatricians play a central role in screening and identifying children at risk. And the statement said pediatricians can do this by incorporating these 2 questions into standard health screenings. And the questions are written there on the slide. So they are: within the past 12 months, we worried whether our food would run out before we got money to buy more. And within the past 12 months, the food we bought just didn't last and we didn't have money to get more. So this policy statement came out. It really galvanized Dr. Cantrell to action. And she not only read the recommendation, she actually then led the charge to do something about it, to actually implement this recommendation in San Diego County. So I'm going to play this audio and switch over to kind of her opening take on this.
Affect many lives.
So Dr. Cantrell set out to figure out, okay, how do we do this? I read this policy statement. I know the next step, but how can we actually incorporate these questions into our regular screening process? And if folks screen positive, then what? How do we actually refer them to resources? So here's what she did first. Her first step wasn't trying to figure this out on her. It was really to find some partners who could help her.
I realized, okay, we need to build a coalition of people who know how to provide these services. So we enlisted the San Diego Hunger Coalition and the Food Bank. Those were our first partners. And we said, okay, this is our project. This is what we want to do. How do we go about rolling it out?
So from those initial partners, which included, as Dr. Cantrell said, the Hunger Coalition, the Food Bank, as well as the San Diego County Medical Society, and Dr. Cantrell's dual role as both a Kaiser Permanente pediatrician and the president of the local AAP chapter, those partners at the table, the group was eventually connected with an organization called 211. And 211 is a San Diego-based nonprofit organization that essentially serves as a resource hub. So they work to connect individuals to a variety of services, from food and nutrition services to housing etc. So they, 211 was really able to complete that second piece of the puzzle, right, which was, okay, patients screen positive for food insecurity, then what? Where do we refer them? 211 really provided that one-stop shop referral destination. So with these pieces in place, the core group of partners met regularly to design this program. And once they had a plan, Dr. Cantrell went out and she made her pitch to doctors within her medical group, again at Kaiser. And here's where essentially just being proactive really paid off.
My medical group, we meet on Wednesdays, and I just found out when, what meeting time would be available or what day would be available, and I just put myself on the docket to use the opportunity to teach them about food insecurity, and then also to roll out of this program. And there's a lot of different groups that have monthly meetings or grand rounds, and that was what I looked at as would be a perfect opportunity to educate the doctors on food insecurity, because I think many of them don't realize the connection of obesity and food insecurity, and I think many don't realize how many patients are food insecure.
Okay, so here's an overview of how this program works in practice. Again, in the words of Dr. Cantrell.
This program is meant to be just automatic, that when kids come in for their physical, it's part of the questionnaires that we ask. There's a lot of questions that we ask parents and about their kids. Are they eating their fruits and vegetables? Are they exposed to secondhand smoke? And so these questions are included with those questions so that it's just sort of a routine, part of their visit. And if the patients screen negative, so both of the questions on food insecurity are no, then that's it, nothing is done. If either one of those questions are positive, then there's two ways you can go about it. And different clinics in Kaiser are doing it different ways. Some clinics here have preferred that the pediatrician is the person who then says, oh, I see that you tested positive on one of these questionnaires, these questions regarding food insecurity. And then that pediatrician hands them a tear-off sheet about 211 that is how to access food resources for their family. Explains a little bit about 211, that it's free and that it's for anybody, doesn't matter about your immigration status. And then they're handed out paper. It's a little tear-off sheet, and we have them all in the offices. Every pediatrician has a prescription pad that they can carry in their coat or at their desk, or we also keep them at the nurse's station. Sometimes some clinics want the medical assistants to do that and just say, oh, I see that you tested positive for this. Here's some resources. That takes the burden off the physician if it is felt that that'd be too much of a burden. And really that interaction would just take a couple of minutes. And then that's it. That's what we call passive referral. There's also the option of an active referral. If the MA or LVN or the provider would like, they could take the patient straight over to a phone and dial 211 for them. And that's another option too. It depends on workflow and how the day is. So what we're doing is we're recommending that at the minimum, people do a passive referral by giving out the tear sheet, and then telling them, hey, at your own convenience, call that number at home, just like you would call 911, but you call 211. And the other option is to actually have them get on the phone right there. That's called an active referral, which you get better results when you do an active referral.
So I'll note that the tear-off sheet is available in both English and Spanish. This pilot just rolled out recently, so I hope to check back in with Dr. Cantrell in a few months to learn more about how it's going and what they've learned along the way. But for now, the program has been rolled out in Dr. Cantrell's Kaiser Permanente facility. So that includes about 70 to 80 pediatricians and that initial coalition that I mentioned is creating a game plan for reaching out to other medical groups in the San Diego area to try to roll this out on a broader scale. So going back again to this question around roles, Dr. Cantrell, if it wasn't obvious from some of those audio clips, wore many hats when it came to this work. So she was a connector, she was an advocate, she was an amplifier, and notably, she really stepped up as a leader on this issue. So here's her again in her own words.
I think you need to have somebody who is that leader and, you know, and continues to be the strong leader throughout the whole program. You need to have that person. Everybody knows who to go back to, you know? Like for me, I always know that the buck stops at me. So as far as moving the program forward, I set up the new meetings. I keep sending out emails to keep them informed. I take the lead on it. I get their input, but then I make the final decision and take the lead. And I think that's what's important, is being that strong leader to say, hey, the buck stops with me. I'm the one who's going to help move it forward with input from everybody else. And when you're that strong leader, I think keeping is having confidence in yourself. And many times as doctors, we're not raised to be necessarily that type of leader. I mean, we lead with our patients, but to lead coalitions, to lead organizations, we're not trained how to do that. So having the courage to just say, okay, I'm going to do it, and I can do it, and I can be the one, having that confidence is helpful.
So I think that that's a really great note to end this specific example on. And I want to wrap up with some guiding tips on getting involved in PSE efforts that I think apply across the board. So whether you're a provider or a public health staffer or another partner, and no matter the topic area that you're working on. And again, for this section, I'm going to be drawing from my conversation with Dr. Cantrell here, just to round it out, because I think she had a lot of really great insights to share. So first, get to know community partners. It's really important that you all know that you don't have to start from scratch, right? In the school wellness example I shared, Dr. Gore joined an existing committee that was already working on an issue. In the food prescription program example, Dr. Cantrell's first step was reaching out to partners, the local food bank, the Hunger Coalition, and through those initial relationships, that's what led her to 211, which is an organization that was really already set up to do the exact thing that they wanted to do in this work.
If we hadn't have been hooked up with the food bank, I don't think we would have been hooked up with 211. We might have tried to create our own call center, but 211 already has this amazing call bank and people that are available 24/7, which we could not replicate at the same cost, and this ends up not costing us anything. So finding the right stakeholders who are also as dedicated and invested, you know, that was key, because they were just as motivated as I was.
So the second tip is really to find your niche, right? You don't have to do it all. In my conversation with Dr. Cantrell, she framed it as play to your strengths. Your role might not look the same as that of another champion provider fellow, and your role, as I mentioned earlier, may change over time. So think about, you know, what are you uniquely suited to contribute? Is it your time and your energy? Is it your medical expertise, your reputation in the community, your ability to lend credibility to work that's happening? Do you like to speak in front of groups, or do you prefer to be kind of behind the scenes? Do you like to write? What networks and resources do you have access to? There are all sorts of ways to get involved that kind of fit within your skill set or your interest level or your comfort level. Third, be flexible and willing to adjust as you go. So for the food prescription program, the original vision for the program was to have providers formally code for food insecurity after having folks fill out that questionnaire and answer those 2 questions. But in trying to roll out this program, the team realized that they might have to give a little on that kind of initial hope in order to actually move the program forward.
We are being required to do so many measures of coding, for instance, did we give a flu vaccine? If we didn't give a flu vaccine, why didn't we give the flu vaccine? And so there was a little pushback about adding another coding measure. This is part of the flexibility of this type of program. I took away the mandatory coding of a positive result because there was a little pushback that, well, if we need to code, we really don't want to push it out right now because we're all doing all this other coding. So that was a barrier that I removed because I realized, wow, if I make them code for this, even though that information is helpful in the future, I'm going to not be able to move this program out at all. And so each medical system can decide what they want to do, whether they want to code for that or not.
So starting small, and in some cases starting with possibly voluntary recommendations might be the best way to get your foot in the door and to get something going, right? So with the food prescription program, over time, as this work becomes part of the routine way of doing business, coding for food insecurity is something that this group can revisit and think about making mandatory. I'll mention another example that came up on my call with Dr. Cantrell. This gets at, I talked about finding the right niche or the right role for yourself in this work. It's the flip side of that, which is making sure that folks who might be affected by what you're doing are part of this process, right? Are part of these conversations with you up front. So Dr. Cantrell shared that when she was rolling out this program, the initial outreach and education efforts, so again, she was, showing up to her lunchtime roundtables with her colleagues, going out and meeting other doctors at other medical offices as well. That initial outreach focused solely on the doctors. So, she gave them some training and information about food insecurity, about 211, about, the services that they provide. But it wasn't just the doctors whose workflow would be affected by this program. So as you heard earlier, in some cases, it's the medical assistants who are playing this role. And so the group soon realized that they weren't actually reaching all of the people who they needed to educate about this change. And so they kind of revisited their initial work and they revamped it to also reach and train and educate all healthcare providers, not just the doctors. So I think that that's just another good example of kind of learning and course correcting along the way. So fourth tip, be patient. Creating organizational change, creating systemic change, creating policy change is not going to happen overnight. So just know that small steps, incremental changes really do add up. And finally, but perhaps most important, is just get started. This is really dynamic work. You're not going to be able to draft a perfect 10-point plan and then implement it step by step exactly as you'd envisioned it. So don't worry about having all of the pieces in place up front. That path will start to become a little clearer, or at least the path that you shouldn't be on will start to become a little bit clearer once you're actually on it. And I think that's often the hardest part for folks.
Just reach out and start talking to people. I think the more people you talk to and you bring it up, then they sometimes maybe they can't specifically help you, but they can point you in the right direction. So even just throwing out your ideas, I think when I started this, I threw out the ideas to my AAP board, and one of the people said, hey, I know somebody on the Hunger Coalition. Let's get them here to talk to us. And then they said, who else? We should get the food bank involved. So I think to start talking to people that you think might be the right people to talk to, they are either going to help you or point you in the right direction. Just start inquiring, and inquiring with who you think would be the right people, and that will get you on the right road.
I think that that's a great note to end on. I want to leave some time at the end for any Q&A and discussion. Before I take questions, just a quick reminder that I only touched on 2 of the 5 playbook topics today, and I only touched on those 2 at a pretty high level. So definitely look through the playbook for more information. You'll all be getting copies of these slides. And for your reference in the slide deck, I also included a series of slides at the end with some screenshots of additional resources related to all 5 of those topic areas. And so all of these can be found on our website if you're interested in sort of digging in more detail into any of the topics covered. Wellness, food security, healthy food beverage standards, safe routes, structured physical activity. And with that, I'm going to pause and to turn it over to Wilgata and Alana to launch us into some Q&A.
Thank you, Phoebe. That was really wonderful and a great way to break down PSE into some very actionable steps. So I will start our Q&A session portion of the webinar. We have time for a couple of questions, and if there's anything that we are not able to address, we will be sure to follow up with you offline.
Do you have any recommendations about contacting community leaders such as councilmen, for example? Okay.
So we have one question. Do you have any recommendations about contacting community leaders such as councilmen, for example?
Yes. So a couple of thoughts there. I think, first of all, it depends on what topic area you're interested in working on. I would start by maybe, I tend to start by figuring out what partners, non-governmental partners in your organization are already interested in this topic. They might have existing relationships with policymakers. They might be a really good entry point for you. The other thing that I'll just note, and this comes up a lot when we talk to folks about, reaching out to policymakers, getting in touch with them. I think that there tends to be, for some people, it seems like a barrier, and it seems a little bit intimidating, and just the reminder that public officials are public servants, and in theory, it's their job to take your call, right? It's their job to listen to you, to hear what your priorities are, to hear what you're working about, and what ideas for your community that you have. So, if this is, if you're working on a program or an initiative, you've got some ideas, you think that's the right target to be talking to, reaching out, pulling up their contact information online, getting in touch with them directly, getting in touch with a staffer and seeing if you can get a meeting on the books is as simple as that. And it might take a few tries and it might take some persistence, but they're really there to kind of listen to your needs and to listen to what's going on in their community.
Our next question, how is 211 funded?
That's a great question. I don't know the answer to that, but I'm happy to flag that and to look into it. It's a separate nonprofit organization based in San Diego, so I don't know where their funding comes from, but they are a separate organization. There may be, this example is from San Diego County, and so they're a local resource. I would look into whether there's an equivalent of 211. So again, kind of a nonprofit organization whose job is really to play that connecting role between community members and various social services. They exist in other places. They're not always called 211. But again, this is what worked in San Diego. And so for folks interested in this, it's a matter of kind of doing that legwork in your community and seeing what the equivalent organization is, if there's an equivalent organization, and starting there.
Yeah.
So we're just going to unmute Dr. Penderkar to ask some follow-up questions.
Hi, can you guys hear me?
Yes.
Yes.
Oh, hi, Alana. Thank you for that wonderful presentation. I did receive my PSE handbook, and I was following along as you guys were presenting. Alana, you and I have spoken about this, and I know you and Dr. Fernandez had some great ideas, but as I'm moving towards this work with the Los Gatos Youth Commission, I just wanted to know if anybody had any specific ideas as to how to move forward, because the last time you and I spoke, we kind of decided that we need to move beyond getting the commission involved with just the educational piece and try to get them to actually implement some policy changes. And I was looking at the one of the places that we can do is the school wellness, and I know that the youth commissioners, at least a couple of them, had questions about the food that is served in the schools, and I just wanted to know if you had any ideas as to how to move in that direction to get some policy changes happening there. Thank you.
So I would say a couple of things for that. One, I think if you've got a youth commission or youth coalition that you're working with, school wellness is definitely an excellent place to start. As I mentioned, working on a formal school wellness policy, schools are required to incorporate a broad range of stakeholders. I would argue that students are among the most important. So I would start first by looking, I don't know if the youth that you're working with are from one school or if there's multiple schools in your community that are represented, but I'd have them look into the policy. And I think that's actually a really kind of great way to get students involved and engaged from the start, is to have them do a little bit of that detective work, do the Google search, reach out to your district office. What does the policy say? What does it not say? Is it satisfactory to you? And I think... So,
yeah. Sorry. So what I'm hearing is try to get them to kind of do the research on that. So, and to answer your question, the way it works in Los Gatos is that the youth commissioners are selected either from whether they live in the town of Los Gatos or whether they attend a school. So there's a possibility of multiple schools being involved, just because not everybody might go to the Los Gatos, the schools within the Los Gatos Saratoga School District. But Saratoga, which is a separate town or city, they are part of the same school district. So I feel like there's wonderful opportunity here, because you could get this going on multiple levels in different places, not just in the town of Los Gatos. So I will certainly look into that. The Santa Clara Public Health Department's Nutrition Department is working on this together with me. And so I will follow up with them to see what they feel about, whether we should do the research. I think we will end up doing that as well, is to look into the policy, the school policies, food policies ourselves, and then at the same time get input from the youth commissioners. Do you think that's something that you would advise?
Yeah, I think that's a great idea, and I can look into if it would be helpful. I don't focus on the school work at my organization, but I'm happy to check in with the folks that do to see if they have any particular examples of really kind of student-led or student-driven efforts to improve the wellness policy. I think that any time that you can get them, I think wellness policies are great because it's a tangible thing, right? You can look up the policy and see what's written and have a reaction of, does this reflect the kind of school environment that I want? Does this reflect the kind of school environment that, I want my classmates and me to be in? And if not, how do we make it better? I think it's a really kind of tangible thing for students to get involved with. And, you mentioned that the commission spans the community. It's not a single school. And so there's an opportunity for students within that commission to then, if this is something that they're interested in and that really resonates with them, to kind of take up as an issue and become leaders on within their individual school, right? So this can kind of spread from school to school as folks in this commission really get their classmates and their friends involved in this effort specific to their school. So I'm happy to any additional examples and information around that.
Okay, the ultimate goal, I think, is to raise the awareness in the different small cities, because eventually the goal, because I'm part of the coalition here, we're working on trying to reduce the consumption of SSBs in Santa Clara County, and so through these side efforts, I think the goal is to increase the awareness amongst the communities and amongst the public, so that when we eventually get there, people will probably be aware that it's coming. So that's sort of the overarching objective to all of this.
Yeah, I think that's great. And I know we're almost out of time, and I'll just say one last thing about that, which is, when it comes to raising awareness, and particularly around reducing soda consumption, I think for youth or for students, the message of, soda's bad, drink less soda, can be off-putting for folks. But when you really involve them in this conversation and talk to them about soda marketing, how they're targeted, how young students of color are disproportionately the targets of marketing campaigns, like that is the kind of entry point that gets folks riled up, and that gets students really invested in kind of shifting that tide.
So that concludes our time. Thank you so much, Phoebe, for a wonderful presentation. I just want to acknowledge Dr. Vanessa Thompson, who is on the call, our principal investigator for the Champion Provider Fellowship Program. I want to thank, of course, all of our participants, our Champion Provider Fellows, our local health department representatives. We're very excited to have your participation in today's webinar, and I think it generated some wonderful discussion. Feel free to follow up with us offline with any questions. We'll be happy to connect you to any resources. A full recording of the webinar, including slides, will be made available to everyone to access online. An email will also be sent out with a link to the webinar recording. For those of you who have not yet received a copy of the PSE Playbook, please get in contact with Alana, and we will make sure that you get an electronic copy, which should be available in a couple of weeks after it receives ADA compliance review. Thank you again to everyone.
Thank you.
Thank you.